The Oncology Clinical Practice and Research Summit is a really important event for our oncology service line as it brings people together. And when I say people, we know it takes a team to effectively treat cancer. Outstanding physicians, nurses, administrators, pharmacists, and all the different specialties involved. Because we want to provide outstanding cancer clinical care, but really side by side, state-of-the-art clinical research along with it. Who benefits most are our patients and the community. We, of course, cover all aspects of cancer. There's cancer prevention and screening, which is critical for a number of cancers. Then if a cancer is diagnosed, we want expedient and effective and compassionate cancer care. And then also after cancer treatment, there's cancer survivorship. And we want to obviously provide those services throughout our hospitals throughout the state of New Jersey and all of the associated practices. Several highlights from today were really going through the spectrum of different cancers, including state-of-the-art treatment of diffuse large B-cell lymphoma, also a great panel discussion of surgical oncology across a host of different surgical oncology experts, including breast cancer, endocrine cancer, orthopedic, a nursing session on managing CAR T-cell therapy, as well as keynote speakers, Dr. Martin Blazer, on microbes and cancer. We know the microbiome is actually very important in some of its interactions with cancer and was a very stimulating session. I've been personally involved in over 100 cancer therapeutic clinical trials, and there was a definite intersection with today's summit. As we not only talked about expert standards in clinical practice, we talked about some of the nuts and bolts of clinical trials. How do you go from idea phase to funding to executing that clinical trial, which thankfully we've been quite successful at the Rutgers Cancer Institute of New Jersey. At the end of the day, the most important aspect are our patients. And how can we deliver the most effective, compassionate, and team-based care across the entire spectrum, across all possible cancers, and bringing to them the best cancer care